Hi, Dr. David Tener. We're here at the Goldberg Tener Clinic where we specialize in the reversal of chronic disease, and delighted to be joined today by our patient, Matt Bristol. Matt came in earlier this year in March 2024. We're now in the late summer in August. Matt's done great and achieved a significant turnaround in his health issues, and he's going to share a little bit about his story. So, Matt, tell us about what brought you in originally.
Well, originally I was having trouble with I've had trouble swallowing. I've had high blood sugar. My blood pressure's been high. Cholesterol's been high. I've had trouble antacids with taking those, and just all kinds of trouble. I've had actually had melanoma cancer on my head that's kind of started making me think about trying to find a way to fix that.
Sure. So really want to take a good comprehensive look at Matt's overall health, and his digestive function was really a major issue. Long-term use of acid-reducing drugs, which can create lots of problems for people, including to increase risk for allergies and blood sugar problems and other issues. And so that was one of Matt's goals, was to not be dependent on that medication anymore. And so, Matt, you had been to a gastroenterologist for just these chronic digestive issues, and
Yes.
what happened with all that?
They gave me different antacids to take, and I was taking one in the morning and one at night, and I was still having problems with still having trouble swallowing, just still having bloating and cramping and just other bowel issues.
Okay. And so one of the major concerns was with Matt's long-term use of acid reducers. When you take acid blockers, they interfere with normal digestive function. This was a conversation we had with Matt when he first came in. You'll be guaranteed not to have good digestion when you take acid blockers. Things like omeprazole, Nexium, Pepcid. So many Americans are taking this stuff. It's about 60 million people in this country that have acid reflux. About half of them are taking some type of acid-reducing medication on a regular basis. But you'll be guaranteed not to have good digestion when you take it, because that stomach acid is so important for good digestion, in particular for your digestion of proteins. It also makes the minerals you consume soluble so that you can absorb things like calcium and iron. And it also, that stomach acid serves as a bath to kill off any pathogens, microbes that come down with the food that you eat. So it's such a critical component of the digestive assembly line. And when that's interfered with, a whole cascade of problems can occur. And even while taking it, Matt was having all these symptoms.
Yes.
And so we're also concerned about his blood sugar. That's another thing we wanted to address, particularly with his history of having had skin cancer. High blood sugar will increase his risk for that. So we did a good comprehensive workup in terms of risk factors that would increase his risk for cancer over time, and want to make sure we addressed all those. So Matt, we had you on a good health building program addressing these problems, and what's changed?
Everything's gotten better. I didn't take any antacids at all, nothing for my cholesterol. I'm taking no medication right now at the moment. I've lost some weight. I feel good. No cramping, no bloating.
No reflux?
No reflux whatsoever. It's been great.
And today we got some new labs. Matt's hemoglobin A1C, which is an average reading of his blood sugar over about 90 days, was high at 6, put him in the kind of early stages of diabetes or pre-diabetes. What was that marker today?
5.5 today.
5.5, right in the normal range. Excellent reading, no longer in the diabetic range. His blood sugar is in much better balance. His cholesterol's also dropped by about 40 points. He's off statin drugs. That's looking good too. He's dropped about 15 pounds.
Sure.
Looking healthy. We repeated some of his urine tests that we run that look at digestive function and also free radical oxidation. Virtually every marker that was a problem before has normalized. And that's consistent with the positive changes that he's reporting in his health. So for over a decade, he's had chronic health problems with his gut, with blood sugar. He's been on medications, which have side effects, and he's really turned things around.
Yes, feeling great.
So real excited for Matt. Matt, thanks for sharing.
Yeah.
His story serves as a great example of what's possible in terms of turning these problems around, regaining health, not by treating disease, but by addressing causes and building health. That's really the ticket to turn these kind of problems around.